Hello, everyone, ladies and gentlemen, dear colleagues. I'm delighted to welcome you for the opening of Santé publique France 2024. First of all, thank you for your loyalty to this major public health event, and thank you to those who are joining us for the first time. There will be more than 1,800 of us for this 2024 edition in this beautiful site of the Beffroi de Montfrouge, as well as remotely. Many thanks to the 70 speakers and the 20 moderators who will present their work and lead the discussions. Our thanks also go to the Santé publique France teams who put together an ever-richer, ever-renewed program for each rencontre. After all, each session, roundtable or plenary session, is the fruit of a proposal from a department or a colleague at Santé publique France. To come up with a program like the one you'll be offered over these 2 days is the fruit of months of work and long discussions. Hats off to them, and especially to the community, to the committee of the rencontre. I would like to thank also the partners who are present in the hall with their stands. And I would like to thank in advance Mrs. Amélie Oudéa-Castéran, Minister for Sport, Olympic and Paralympic Games, who will be joining us shortly to close this first morning. Obviously, in this Olympic year, physical activity and sport activity have been declared, and you know it, a major national cause. And the Santé publique France meetings have been approved officially as part of the official program of the Great Cause 2024. That's why we're proud to be part of the large community of players rallying to promote this great cause and to convey essential public health messages. I'd like to thank Vincent Roger, Ministerial Delegate for the Great National Cause, for all the actions that we've built up and developed together as part of this partnership. Physical activity and its corollary, sedentariness, are major determinants of health status as you know it, but it's also essential factors in terms of prevention and health promotion. Last week, actually, for the first time, the French National Authority for Health placed at the top of its list non-drug therapies, including physical activity, for healthcare professionals in the management of type 2 diabetes. Promoting physical activity throughout the population is clearly a public health issue that is really important. The results of the Santé publique France 2021 Barometer on Physical Activity were published this Tuesday in the weekly epidemiological bulletin. They reveal the gap between the reality of the practice and the French people's knowledge of recommendations on physical activity and sedentariness. In 2021, for instance, we learned that more than 70% of men and just under 60% of women were meeting recommended levels of physical activity. In addition, more than 1 adult in 5 declared spending more than 7 hours a day in a seated position. So, all these recommendations were mainly associated with socioeconomic factors such as gender, age, or geographic location. It varied by more than 15 points between regions. And, dear ladies, women's physical activity levels are always lower than men's, making them a priority target group. I count on you, ladies, as well as older people and those with fewer qualifications. We can legitimately ask ourselves whether our fellow citizens are really aware of these recommendations. In fact, they're only partially so. The good news is that almost 97% of the French people can quote at least 30 minutes a day, but less than a quarter quote the right intensity. And actually, among us, do many of us know it as experts? Yes, maybe, but not amongst the general population at large, because only 1 in 5 French people know the full recommendation, which is, and you know it, to exercise at least 30 minutes a day, but with breathlessness. And these results relate to the situation in 2021, and I hope that they will be better this year because it's an Olympic year, thanks to being a major national cause. But these results also show that we need to educate French people about the notion of PA intensity and to help them better understand the benefits for their health. With regard to the sedentary lifestyles, the results show that the recommendation is well known. The most sedentary adults perceive that they spend too much time sitting without being able to reduce their sedentary lifestyle. This underlines the importance of developing preventing measures in the workplace in order to create more favorable environments. And Santé publique France is very much laying an emphasis on this. Physical activity is a protective factor against many non-communicable diseases such as cardiovascular and metabolic diseases and certain cancers. This is why it is essential to promote physical activity, because they have a real impact on both individual and collective behavior. This is borne out by the excellent results of our campaign to encourage activity among teenagers. And we're repeating it as we speak, and you can see it again. These results also show how fundamental it is to mobilize all the levers available at home, in the office, in the community, in the way common spaces are designed, but also means of transport. And even at Santé publique France meetings, we offer physical activity workshops with a sports educator and a yoga teacher. This is the yoga teacher that accompanies Santé publique France agents in their yoga practices. Thanks to the French Ministry of Sport and the French Table Tennis Federation, and I say hi to them, we'll be able to get moving to sport up during the breaks on the tables available to everyone. Have you seen them? Dear ladies and gentlemen, not yet? You have noticed them. So ladies, if you have heels, please do not sprain your ankle. Right. Sport should be done in the right conditions. I can only advise you to take the stairs during these 2 days to get around the building. And if you'd like to measure your level of physical activity, I invite you to take the test on our website called Manger Bouger, to eat and sport up. In this Olympic year, the partnership with the Grande Cause Nationale is also part of a more global commitment by the agency to help make this global event a national success. Indeed, holding a global event such as the 2024 Olympic Games rallies all of Santé publique France's missions, and the vast majority of our agents will be mobilized both in Paris and in the regions for the whole duration of the Games, and I would like to thank them dearly. We've been preparing for this for over 2 years with the Ministry of Health, the Ministry of Sport, as well as Paris 2024 and its partners. We will be deploying a reinforced surveillance systems for health risks throughout the duration of the Games, whether they're linked to the importation of diseases, to the transmission of diseases facilitated by contact between people, or to exposure to risk present in France. During the summer months especially, we will also be head-on to deal with specific risks, such as those linked to heat, arboviruses, and drowning. Monitoring will cover all populations in mainland France from July the 8th to September 15, 2024. The aim is to detect early, to rapidly assess impact to inform decision makers in real time and support the implementation of management measures. Finally, to provide transparent, quantified indicators of health-related events during the Olympic Games. For the Olympic Games, Santé publique France was involved in preparing preventive measures. In line with the main health risks identified, 3 priority themes were selected: heat wave, measles, and arboviruses, in particular dengue fever. We provided support to Paris 2024 measures and messages in the event of a heat wave, so as to be in line with those we usually convey to the general population. The distribution of our tools has been amplified, and given the influx of French-speaking tourists, they have been translated into English. Through a partnership with the RATP, the tube services, prevention messages will be broadcast to the many visitors who use public transport, particularly near the competition sites. Santé publique is also working with WHO ECDC to develop a prevention document for foreign travelers to France. This mobilization reflects the scope of Santé publique France's mission. It is a committed group of men and women, more than 500 employees mobilized nationally and regionally to collect and analyze data, alert and provide the expertise to inform decision-making, organize deliveries of medicines and vaccines, and send thousands of reservists answering millions of calls to our helplines such as drugs info service and designing dozens of prevention campaigns and messages. And for the past year, I've been lucky enough to be at the helm of this fine organization, and I would like to thank all my co-workers. Over the next 2 days, we'll be sharing experiences with the scientific community, decision makers, representatives of civil society, and players in the national public health network, putting them into perspective and outlining the major challenges for the health of populations. For us at Santé publique France, every year these meetings are the crucible for our reflections and our ambitions in favor of an environment favorable to health of populations, particularly the most vulnerable. In this year, the year of the Olympic Games and the national cause of physical activity, this is the theme of the event, with several sequences devoted to it. I won't go back to all the sequences, but I'll mention a plenary session on experimentation and behavioral change, including an OECD presentation on effective policies for increasing physical activity. There will be a focus on adapting one's sport and physical activity in the context of climate change, which will enable the theme to be approached through a global health approach. We'll have also a session where we learn the teachers from our British colleagues on the Great Britain experience as host of the latest Olympic Games. But as every year, the entire spectrum of public health will be explored over the course of over the 2 years. In the latest innovations in public health, preparing for zoonotic threats, the evolution of surveillance methods for those of our ecosystems, the use of behavioral sciences and the impact of global change on our environments and therefore our health. Public health contributes to improving health for the greatest number of people. Together, we must continue to vigorously promote a tobacco-free world, reduce alcohol-related risks, prevent addictions, promote healthy eating and physical activity, and foster environments and ecosystems conducing to health. This implies enhanced contributions and collaboration, not only between all healthcare players, and you know how much this is important to me, but also with other sectors such as the social, economic, environmental, sports, transport, and urban planning sectors. This is how effective public health strategies are developed. In any case, this is Santé publique France's conviction and my conviction. We are fully mobilized and we believe in an innovative, cross-disciplinary, collaborative approach to public health that enables everyone to live in peace, serenely, in an environment conducive to good health. Thank you, and I wish you 2 rich and fruitful days. Thank you.